So it's really exciting to see it working and happening. But one of the things that we noticed for years is that all these patients who wanted to do the program previously, the pain program, specifically, they wanted to do all this stuff and they couldn't actually get to the office. They didn't have rides. And if you've been in pain for a long period of time, in a lot of states, you lose your driving privileges, right? So, the doctors have to report things, and you start, one of my favorite stories is from a lady who she's about the same age. She's in her mid to late 70s and had chronic neuropathy and was able to recover from the neuropathy pain. And then about 4 or 5 months later, she showed up to show everyone her brand new driver's license. And 15, that's like 10 or 15 years since she had driven at all. But she was able to get her license back because the pain was gone, because she was getting out and active again. But that kind of thing is, not everybody can get around. And because people can't get around, they don't have a way to get to an office the same way everyone else does. So I think a lot of people just forget that. They forget that there are hundreds, maybe even thousands of patients, in the region where they live who are largely, non-ambulatory, non-mobile. They can't really go places. They can get around their house, but they can't just go get in a car and drive somewhere.